Greetings from Dr. Gupta's clinic. Today we are going to discuss a new subject, new topic, and that is women getting pregnancy from a single ovary. Last few years we noticed that the women suffering from infertility also have a single ovary. It is either due to ectopic pregnancy earlier or some diseases earlier which we are going to discuss here in this topic. So here is your tips how to get pregnant if you have a single ovary. Yes, when you are at Dr. Gupta's clinic, you will get the best medical service. Whether we are at Calcutta or Delhi. In Calcutta, we have got three centers: Girish Park, Sodhpur, and Excite Crossing. So wherever you reach us, you're in good hands, experienced hands, and be comfortable. Why women with single ovary are increasing in number? The first reason that comes to our mind is that women are increasingly becoming sexually active right from the college days, and they have a multiple partner. So having a multiple partner leads to more infections in the lower genital tract, which grows up to the ovary and through the fallopian tube, and there is an abscess, and that makes it a tubo-ovarian mass. So this is basically starts as a sexually transmitted infection which grows into the tubo-ovarian mass. Ectopic pregnancy because of the lifestyle disorders is also getting prominent. Endometriosis is also increases in numbers, and we all know ovarian cyst, polyovarian cystic disease syndrome, or PCOS is a very common phenomenon today. What is a tubo-ovarian mass? Tubo-ovarian mass is a kind of a say abscess or something which surrounds the end of the fallopian tube and it covers the entire ovary. So that the ovary becomes damaged, it becomes painful, there is a tenderness, and then there is a lower abdominal pain, there is a back pain, and there are a lot of complications. Sometimes it is detected while patient is complaining only of persistent vomiting. So this is becoming a problem in women these days. So the woman has to be very conscious about their hygiene. Endometriosis is a disease where the endometrium, which is supposed to stay inside the uterus, sometimes comes out of the uterus and spreads to the neighboring spaces. Now, this endometriosis, when it gets stick to the ovary, it creates an tubo-ovarian mass again, and an ovary has to be dissected out. Again, a lot of stress. Girls these days are undergoing a lot of more stress, and these stress hormones are responsible for the creation of this disease called endometriosis. This endometriosis needs to be treated, but if after the treatment, if the pregnancy does not comes altogether spontaneously, then we have got to go for a treatment which we do as an OPD procedure and with good results. Ovarian cyst, as we had discussed earlier, is a result of unhealthy or not completely active hormones. So the ovulation, during the ovulation, the ova may not come out, stay inside the ovary. They may not be able to break the outer wall of the ovary, stay inside and keep growing, and then this becomes an a cyst. So this is the problem of an ovulation disease which requires some treatment, but in case the cyst becomes too large and is uncomfortable, leading to pain and vomiting and other symptoms, then we have to remove the ovarian cyst, and while removing the ovarian cyst, inevitably the ovary also gets removed. PCOD, ovarian cyst, is a very common condition, and every woman should be aware of it because this leads to infertility. How does the ovarian cyst looks like? We have given a diagrammatic representation, but It may causes menstrual irregularities as the first symptom, and you have to be very careful about your ovary. So to prevent the ovarian diseases, we advise the people not to put on weight, not to eat too much of fried food, not to eat too much of carbohydrate food. You know, this is the main cause of ovarian cyst. Now, carbohydrates, is the most addictive substance. It is more addictive than the drugs. It is more addictive than alcohol. It is more addictive than cigarette smoking or tobacco abuse. So the carbohydrate intake should be restricted in all persons right from the beginning, because once a baby is there, we have a tendency to feed the baby with chocolates and other sweet items, and that leads to an addiction for right from the very early life, and this addiction remains throughout the life. So this addiction should be avoided. Parenting should be good and strict, and therefore this disease can be prevented. Now, what we require for pregnancy? For pregnancy, we require a healthy ovary. That means it is ovulating, and the healthy fallopians, which is catching the ova. Then we have to have a healthy sperm, which is capable of fertilization. Then we need to have healthy hormones that will take the fertilized egg into the uterus, and that the pregnancy has to be maintained. So these are the conditions. We have to see them. If they are unfavorable, we have to make them favorable, and that is a treatment of pregnancy. Now, where do and how do we start? We do the follicular test to first find out whether the woman is ovulating or not. If there are an ovulatory cycles, but in the case of single ovary, a woman will ovulate normally only once in 2 months. But we have to see that ovulation cycles are not missed. And then we have to check the woman's hormones, the AMH, which gives us an idea of ovarian reserve. Then we have to check the woman's FSH, because FSH is the responsible hormone for follicular development. LH is another hormone which is required for the follicular development and exit of the ova from the ovary. We require to see how much the progesterone is there in the body, because that is a hormone which is responsible for fertilization. And finally, estrogen, which is a double-edged sword. High estrogen during the time of follicle period will lead to non-development of ova, and once the ova is developed and fertilized and embedded, the pregnancy starts, the role of estrogen becomes very important. So we have to check all the hormones, correct the hormonal level, see the patency of the fallopian tube, and see the hygiene of the woman, and treat them accordingly. And once the treatment is done, the results are fast. If the fallopian tube is patent, the results will be are almost definite, and the results in happy pregnancy, happy child. I am sure that the common tips, some tips which we have shared about the requirements and treatment of pregnancy with a single ovary, which is normally a difficult process, but we have explained in a simple way. Hope you will find it useful and will like this video and share this video with your friends who are in need of this kind of a treatment.